No, I'm a psychologist, okay, organizational behavior consultant, and a trauma therapist. So ano po ba ang trauma therapist? Ano ba pinagkaiba ng psychotherapist sa trauma therapist at psychologist? Of course, psychologist, yun yung licensure natin, di ba? Whether you're industrial, clinical, educational, so iba-iba yan, no? But the thing is, not only that I'm a organizational behavior consultant, no, or I also specialize in IO or industrial organizational psychology. I am also into clinical, but my specialization is more on psychotherapy in dealing with people who are suffering from trauma. Okay, ano po ba ang trauma? So just to give you, let's say, an overview, or let's say an enlightenment, ano po ba yung trauma? Yun yung naririnig natin na when it comes to calamity, when it comes to painful experiences in our lives, okay, and then what mental issues, no, nanggagaling doon when you had that painful experiences on your life. But most of my clients, I would say, are victims of sexual abuse and violence. Okay, so hindi lang po siya calamity. Trauma is a very broad, I would say, topic, or very broad spectrum siya. Okay, but I'm just going to emphasize here now what had helped. No, this is just the basic. Okay, what had helped me in terms of connecting to my clients. Kasi when you become a psychotherapist or trauma therapist, you need to connect, to empathize, and to understand with your clients. Okay, so we all are suffering from mental issues at some point. Okay, nobody's immune, sabi nga ng mentor ko. But on this topic, how are we going to avoid telling some terms that might have hurt people who are suffering from mental issues, and how are we going to help them? Okay? All right. So if I may ask, no, sa mga participants natin, I'm sure narinig nyo na to at some point in time, di ba? If I may ask, no, you can type your answer in our chat box. Ano dito yung naririnig nyo o narinig nyo na sinabi sa inyo? O sinabi ng somebody, okay, sa kakilala nyo? Anybody? Meron na po bang nagsabi yan? Attention seeker, no? Thank you, Raquel. Yes, attention seeker lang daw yan, yung bipolar. Okay. Nakaka-OC. Yes, we've heard of it, no? And sometimes, and most of the time, no, para bang they're just throwing it, that as if na parang wala lang. No? Parang nagkape ka na ba? Parang kumain ka na ba? They're just throwing it, no? But the thing is, these words, no? Especially if you're having that kind of mental issues, okay, really hurts. Okay? Yan. Anxiety is just part of life. Okay, so men don't get depressed and all those things. You're too shy. These are the words that usually people throw at us or throw at people who are suffering from mental issues. So, hindi po gawa-gawa ang mental issues or mental disorders or mental illness. Okay, it's actually the wound in our mind and in our heart that cannot be seen. Okay. So thank you for those who participated, no? So I'm going to discuss, okay, so ano po ba yung first person language, okay, muna, at identity first language. Kasi nabanggit natin kanina, okay, people just throw at us na bipolar ka, gawa-gawa lang yan, no? And all those things. So first we're going to describe, no? Ano ba yung person first language and identity first language? Okay. So first, okay, yan. In person first language, the person is emphasized, not the individual disabling or chronic condition. Okay? So ito po yung hindi po natin ina-associate, no, dun sa tao na, for example, autistic ka. Okay? Hindi po ganon. So it's like person with autism. So inihiwalay natin, okay, yung tao at yung disorder niya. So if you're going to, let's say, describe, if you're going to say, sabihin natin na para bang talk to a person with autism, hindi po natin sasabihin na autistic ka, no? Or let's say sabihin natin mongoloid ka. That's very derogatory or hurtful. But instead, we're saying person with autism. Okay, so wala din po pinagkaiba if you are, let's say, disabled, no? Hindi po natin sasabihin sa tao na lumpo ka, no? Or all those things like person with disability. So, yun po yung tamang term, person first language. And the next, what is identity first language? Okay, so yung identity first language, this is a disability become the focus, which allow the individual to claim the disability and choose their identity rather than permitting others to name it or to select terms with negative implication. So ito yung para bang kinlaim mo. Okay, autistic person, no? Yun yung parang the person permits that. The person allows that, but we don't just throw it dun sa tao. And at the same time, no, I have clients as well na hindi ko sila tinatawag na victims of abuse. I call them survivors, no? Ang maganda kasi is we empower people. Okay, we're just not limiting them, no, dun sa kung ano yung current status nila, but we need to also empower them. So for me, to those who suffered from abuse, we call them survivors of abuse. So meaning they have gone through it, no, they have tried and they have survived. So how are we going to choose naman between person first and identity first? Okay? So para hindi tayo nakakasakit, no? And we need to also respect the boundaries, no, of each other. So first, both person first and identity first approaches to language are designed to respect disabled person. Both are fine choices overall. So whether you choose them o kung ano man dyan, it's fine, no? But when it comes dun sa identity first, make it a point that the person claim it, no? For example, yung kaninang pinlash ko kanina is a person with autism, no? Or person with disability. Okay? So hindi natin siya basta pwedeng i-throw na lang yun sa tao. Okay? So it is permissible to use either approach or to mix person first or identity first, until you know that the group clearly prefers one approach. Now, I actually have this client, no? She's actually a member of LGBT, okay, community. Now, she told me that she had an argument dun sa kapitbahay niya, no? At yung kapitbahay niya, talagang tinawag siya directly na, hoy, tomboy, as in ganon, no? So for her, no, as a member of LGBT, yes, she acknowledged that, but you don't have to say that directly to my face or directly na para bang you're not even asking if I want to be called that. Yes, I am a part of the LGBT community, okay, but you don't say that to a person, okay? Magpasintabi ka muna. Even if you see it is obvious, make it a point that the person, no, is not just, yung parang kinakahon mo siya dun sa identity niya. Okay? Or dun sa kung anong sitwasyon niya. Kasi people can change, no? At hindi lang tayo basta yung parang limitado sa kung ano yung meron man tayong physical aspect, whether it's gender, whether it's mental disorder or something, you just don't identify yourself, okay, with the mental disorder or with your physical disorder. Okay, we can thrive, we can thrive, and we can inspire. Okay. So now the use of person identity and identity first, this is the problematic, no? Mga list ng problematic. Yan. Okay, so special needs, physically challenged, mentally challenged, okay, mentally retarded, and mentally ill. Okay, so this is the preferred one. Person with disability, disabled person, person with mental illness, person with intellectual disabilities, child with a birth impairment, and physically disabled person. So try as much as possible, no, or if you can avoid, not to, let's say, sabihin natin na say those problematic words, okay? But rather, dun tayo sa preferred, okay? And then what the use of negativistic terms or slur, ito we hear that, no? We hear this specifically kalimitan, no? Alcoholic, drug addict, no? Cripple, invalid, okay, and all those things. So if a person is suffering from that, we can use this the preferred, no? Okay, which is wheelchair user, person with traumatic brain injury, physical disability, person with mental illness, person with alcohol use disorder, and or person with some substance use disorder. As what I've said, hindi natin pwedeng ikahon, no, or i-define ang tao based on their physical capabilities, no, or mental illness. All right? Because of course, we don't want to be identified with that. Right? Okay. Any question? Can we entertain questions now or later na lang? Hello? Later na lang? Later po. Okay, sige. Thank you so much. Kasi gusto kong as much as possible, no, na nakikita yung interaction or kung meron pang mga any clarifications yung participants natin. Okay. So, I'm going to discuss a little bit, no, with regards to Carl Rogers, okay, on person-centered therapy. So I'm sure most of us have known Carl Rogers. At kung hindi nyo kilala si Carl Rogers, okay, nag-theories of personality na ba kayo? Okay. So if I may ask, no, sorry ha, magtatanong ako. Okay, so if I may ask, sino si Carl Rogers? Okay, and what do you know about Carl Rogers? Ano yung natatandaan nyo? Good. Conditional positive regard. Free will. Who else? Empathy. Okay. Conditions of worth. Right? That's good. Uy, papasa tayo ng board. Carl Rogers is included, no, sa board exam for theories of personality kasi it's one of the, I would say, not necessarily nag-revolutionize, no, but when it comes dun sa theory niya, it's really effective up to now. Okay? So parang yan ang pinaka-basic if you want to go dun sa pagiging therapist, no, or healing clients specifically. Okay, so first is congruence or genuineness. Okay, so to be congruent means to be real or genuine or to be or integrated to be what truly is. So meaning congruent is hindi ka naman magiging para bang you just say what you want in your client. Okay? But at the same time, you have to be real as well to your clients, no? So I actually have some clients na battered wives, no? So when you say battered wives, they are stuck on a relationship that is very abusive, no? And they're having a hard time getting out of that relationship. So what I usually do dun sa mga clients na yun is I make it, let's say, I understand their situation, I empathize on their situation, but the thing is, I speak the truth about their situation or the reality of their situation, that your husband or your partner is already hurting you. Okay? So I know it hurts. I know it parang, kaya lang kasi you need to put a light on their mind, no? Kung anong sitwasyon nila so that they can better heal and they can move forward sa buhay nila. Okay? So that's meaning of congruence or genuineness. You have to be real, you have to be you, but it doesn't necessarily mean that you're just free to say what you want to say. You have to also think about what you're going to say. If it's gonna hurt them, or it will gonna help them. Okay? And then next is unconditional positive regard. So when you say, tama yung sinabi kanina, no? When you say unconditional positive regard, this is a feeling of total love and acceptance, okay? Like that of a child for a parent or a pet to its owner, okay? So matter what you say or do, you will be loved and accepted, okay? So when it comes to unconditional positive regard, This is accepting the person, as they are, their situation, without any judgment. But at the same time, if you feel that you are disrespected by the person, okay, it doesn't mean you're going to tolerate it. Acceptance is different from tolerating. Okay? So I actually also have this client, that they are naman the perpetrators. When you say perpetrators, they're the one who caused the abuse. So if you are coming from an advocacy of women empowerment, and you help people that is abused. So parang you're accepting client who are the abuser, or let's say the perpetrators. Parang it's a bit ang hirap tanggapin, no? But ang pinaka-importante noon is you don't judge the person on what they do. Instead, if they want to seek help, okay? If they want to, let's say, to better themselves, then that is the unconditional positive regard. You don't judge them on what they do. You help them on moving forward, but make it a point that they also will accept the consequences of their actions. Okay? Because lahat po tayo nagkakamali. Of course, I'm not saying na gawin mo yung pagkakamali na yon. Okay? When I say pagkakamali, lahat tayo nadadapa. Lahat tayo may mga bagay na pinagsisisihan natin na sana hindi natin ginawa o sana hindi nangyari sa atin. So now kung yung tao is seeking for help, seeking for understanding, seeking for enlightenment, why not help? But of course, you have to set boundaries for yourself kung ano lang yung kaya natin, and at the same time, don't judge the person. Okay? So if you want to be a psychotherapist someday, judging, criticism, and attacking is totally not in our vocabulary. Okay? So empathic understanding. Okay, so this exists when accurately sense the feelings of the person, and are able to communicate this perception so that the person know that the other person has entered their world of feelings without prejudice, projection, and evaluation. So when it comes to empathy, it's not about kawawa ka naman. Okay, it's not about, let's say, para bang you pity that person. Okay? It's about understanding them, what it is like to be in their shoes. But there are times that it's hard to empathize and it's hard to understand if you didn't undergone that same situation. Of course, hindi ko naman sinasabing kailangan yung magkaroon ng mental illness, or let's say sabihin natin na mental health concern for you to understand. It's just that if you want to heal or to help other people, make it a point that you help yourself first. Okay? Make it a point that you understand yourself first. You're coming from a place of finding the wisdom behind your suffering or your pain before you can truly connect to people. Kasi when it comes to dealing with people that have suffered so much in life, okay, pity and, let's say, sympathy is not what they're looking for. What they're really looking for is understanding and a guide on how they're going to find wisdom behind what they've gone through. Okay? And that is the cornerstone of healing. Okay? Understanding. So, we think we listen, okay, but we very rarely do listen with real understanding, okay, true empathy in a sense. Yet listening, this is a very special kind, and is one of the most potent forces of change that I know. That is according to Carl Rogers, okay? So don't just listen to rebuttal. Listen to understand. All right? Kasi there is a lot of, things that you can get dun sa words nila. If they're saying na okay lang ako. All right? Minsan hindi naman talaga sila okay. All right? Of course, hindi natin sila dapat pilitin. But instead of, para bang judging the person na hindi mo dapat nararamdaman yan, Di ba dapat masaya ka? Kasi okay naman yung buhay mo and all those things. You have parents or something like that. Try to listen kung saan nanggagaling yung pain nila. Okay? Because a person that is coming from a place of peace and love, no, will not necessarily parang approach you to seek help. Okay? So, when a person comes to you, when a person seek for your help, listen first and understand, not to project your perception, okay, or your beliefs on them, but instead try to understand them. Minsan, or most of the time, no, we don't need actually yung parang payo, no? We don't need, yung parang comment sa other person. Sometimes, or most of the time, we just need somebody to be there to listen and to understand us. Okay? And that is very powerful. So what are the important behaviors when dealing with a person with mental issues? Ano ba yung dapat natin na pinapakita sa mga tao na nagsasuffer, no, ng mental issues or mental illness? So first, we're going to check yung nonverbal behavior natin. Okay? So nonverbal gestures like body positioning, facial expression, hand movements, and the like are important to effective cooperation as spoken words, no? So nonverbal gesture, actually most of the communications or 70%, 80% is nonverbal, okay? So even if you're saying otherwise, and you are not, it's not showing in your face, ang hirap maniwala. Okay? So, and there are times na even if you don't speak, just your nonverbal gesture is more than enough to communicate dun sa tao that they are understood. Alright? And there are times when my clients, no, are in agony, are in so much pain. They are telling me that this is what that was done to them and all the things. I don't say, yaka, parang, ay, bakit ganyan? I don't say that. Okay? Or I don't project that. I don't show it on my face. I just, if I feel for them, no, I say that I understand you. Okay, I feel you, right? But I don't show it to my face na, parang ganyan or something. Now there are times, no, that I was also triggered, but as much as possible that I don't make the other person feel that what they're saying to me, no, is not valid, no, and I make it a point that my nonverbal gestures is I understand it. Okay, that's the point. Now, personal space, okay, now if you're having a face-to-face, no, so far kasi ako ngayon, hindi pa ako nag-face-to-face, no, personal space is mediated at least somewhat by culture, age, and gender, okay. Individuals vary greatly in their degree of comfort with personal space. So you have to be very careful when it comes to personal space. Especially kung halimbawang lalaki ka, no? Lalaki yung therapist and then other gender yung client mo. Okay? And also with your friend, no? Kung halimbawa you're confiding with a girl friend, you can sabi girlfriend, no? Babaeng kaibigan o lalaking kaibigan. Okay? So, hindi mo basta pwedeng yakapin, hindi mo basta pwedeng hawakan. Ask them if they want to be touched, if they want to be hugged. Alright? Don't just cross their boundaries. Ask. Now, with regards to women, or let's say to people, no, that were my clients that were abused, I don't just touch them. I ask them. Okay, even if they're already comfortable with me, I ask them, can I hold your hands? Okay, can I tap you on your shoulders? Yeah. Kasi they are very para bang mistrusting. Okay, they are very yung safety nila was damaged. Okay, so you have to create that safe space for them. All right, and then touching at important moment is quite natural. However, okay, it is important for each of us to be sensitive to person's boundaries and our own boundaries. Now, when it comes to your own boundaries naman, okay, it's all right to say no. Okay, it's all right to, let's say, I'm not comfortable in being touched. or even I'm not comfortable in that kind of words. Okay, it's not because of you, but it's just that it triggers me. I'm not comfortable with it. So right, no, we have to respect each other's boundaries. And there are times that people might say things to us na it's a form of concern. It's a form of parabang care for us. But we think that our boundaries are being crossed. No? I actually have this parabang office mate before. No? Basta office mate before. And yung parabang he tried to kiss me. Parang beso-beso. Kasi he's doing it to a lot of female co-workers. For me, I don't like that. Yung kiss sa cheeks lang, no? Hindi masalit, syempre, no? Para bang okay lang yung iba, beso-beso. So I said to him na I don't want, no? I don't want na magbeso-beso. At sinabi niya sa akin na arte mo naman. Oh, arte mo naman. But I'm not comfortable. Even if other people is willing, if you're not comfortable, it's all right. Okay? It's your body, it's your mind, it's your right. So if people are telling you, no, ang arte mo naman, ayaw pahawak, ayaw pa-kiss or something like that, it's my body, it's my right. Okay? Hindi po siya kaartihan. It's called respecting each other's boundaries. And then, of course, you say it in a respectful way. Ha? In a respectful way. Okay? And then, of course, listening skills, napaka-importante po nito. Okay? We don't listen, no, para i-chismis sila. We listen to understand. Okay? So, listening helps to build trust, convinces the person that you understand him or her, encourages the person to reflect on what he or he has just said, and ensure that you are on track with the understanding of the person. Now, there are times that I actually ask my clients, is this what you said? Okay? I just want to have a clear picture na if I get you, if I get your situation. But of course, as much as possible, no, na wag mo na paulitin sa tao. But the thing is, it also helps, no, that the person is acknowledged na yung parang you're listening to them when you ask na, have I heard it right? Have I, let's say, perceived it right? Okay? Kasi when you do that to a person, nakikinig to sa akin. She's trying to understand me. So that's the very important in listening skills. And as much as possible, patapusin mo muna yung tao, no? And you get the gist of what the person is saying before you start asking questions, okay, or some clarifications, if ever, no? And one more thing, no? There are also some friends of ours, no? Na para bang they're just venting and venting, ranting and ranting, no? I also have some friends, no? Na para bang I ask them na, what do you specifically need of me? Do you want someone, no, just to listen, na magbe-vent out ka, or you want me to give you an advice, no? But of course, before you start, let's say, sabihin natin na accepting people, no, that they will vent out on you, or they will say their problems to you, make it a point that you have emotional and mental space for them. Don't accommodate people if you yourself is having problems. Kasi mahirap pagbuhat ng bagahe kung ikaw mismo sa bagahe mo, hirap na hirap ka na. Even as psychotherapist, no? So, I'm just going to share this, no, to you. It's like, of course, self-care is a must for us, and self-love, no? I also have clients in the middle of the night messaging me, okay? And telling me na they're gonna commit suicide. Okay? I need someone, I'm going to commit suicide. Hindi ko na kaya and all those things. And I tell them, you can call National Center for Mental Health because they accept calls 24/7. Okay? Now, it might sound harsh, but if I don't take care of myself, if I don't give myself enough rest, no, how can I give more to my clients? Okay? So you also need to learn how to set your boundaries. And I also have some friends na at 4 a.m., they're going to message me, I need your help. No, kailangan ko ng kausap. Okay. I tell them, give me until 9 a.m. No, for me, for us to talk. No, give me until 9 a.m. because I need to, para bang, yung clear my head. Kasi kagigising mo lang eh. Alas 4 ng madaling araw, kulang pa ang tulog mo, tas may tumatawag sa'yo, I need help, ganyan or something. Wait lang, ano ba yan? Okay, emergency ba yan? It's about mental health. Can we just talk at around 9 a.m.? Okay? Kasi I don't have emotional and mental space for you right now. Because my rest is not, 100% or hindi ako fully rested. No? For me to be present to you. And it will cause more damage than good. Okay? So yon. But of course, syempre kung medical issues yan, and something, then you can help. But yung parang they will bend out on you on 4 a.m. Wait lang, can we just talk about later? No? Okay? So yeah. And then, okay, so getting started or approaching the issue. Okay, so how are we going to approach the issues, no, to people who are suffering with mental health? Okay, so don't be afraid to talk about it. Reassure them that they care about, that you care about them, rather, and be there for them. As what I've said earlier, just being there, understanding and listening, malaking impact na siya, or malaking, let's say, kagaangan na siya if someone has understand you or understood you. And wag po nating pipilitin. Okay? If the person is not, let's say, kahit nakikita mo na they're already manifesting some symptoms of depression or anxiety, okay? If they are not willing to talk about it, don't force them. Okay? Iba-iba po ang proseso niyan. And wag din tayo ma-offend if in case hindi sa atin nagsabi yung tao, at sa iba nagsabi. Okay? Nandito ako para sa kanya, friend niya ako, ba't di niya ako sinabihan? Kasi you cannot be for everyone. No? And I also have some clients na lumalapit sa akin asking about ADHD, postpartum depression, and all those things. Yes, I know the basic, but I think I'm not the right psychologist for them. All right? So I refer them. Even if yung pinagpipili, ikaw yung gusto kong therapist or something, I cannot help you. Okay, it's not about you, it's me. It's not about you. It's my let's say capabilities. I'm not trained for that. Okay? I don't have, let's say, substantial, or let's say sabihin natin na parang training. Okay? Or knowledge. Yes, I know the basic, but for me, I think I'm not the right psychologist to help you. So it's all right, no? And of course, not all people can be everything. If your friend cannot help you specifically with a certain issue, it's all right. No? Kaya nga, we need a community. A person cannot be everything. Even if it's your boyfriend, your partner, and all those things, they cannot be everything. All right? So you need a community for that. And then use I statement. For example, I am worried about you. I would like you to consider talking to a counselor rather than you are or you should. Okay? So nobody likes to be, sabihin natin na, criticized, okay, blamed, attacked, or judged. All right? So come into a place of this is what I think, this is what I feel. All right? Rather than na, ikaw kasi, ba't ka kasi ganyan? No? Alam mo, tingin ko, parang, ano ba tawag dito? Hindi na okay yan eh. Hindi na okay yung ginagawa mo. That's very hurtful. So it's like, talk to the person na I think, no, or I feel, okay, that you are suffering. No, I feel. Would you like me to help you? Or maybe I would like you know to consider talking with a counselor or all those things. Okay? So come into a place of this is what I think and this is what I feel. Kasi we are all operating on different perceptions. And then, of course, try to show patience and caring and try not to be judgmental of their thoughts and action. Okay? So, try to listen. Try to understand. Now, if their beliefs is not within their beliefs, it's all right. Okay? Kaya nga, iba si, yung nakikita ko doon, si Zara, iba si Len, iba si Charlene. Alright? Iba-iba tayo. But we can always be there for each other. Listen. Okay? Remember this, relationships can heal you and relationships can also break you. So if you surround yourself with good, positive connections, no, it will really change your mindset. But if you surround yourself with negative and judgmental, no, or mga nagki-criticize na tao, then it will really affect your mental health. Okay? So listen and don't disregard or challenge the person's feeling. Yung parang hindi mo dapat nararamdaman yan. Okay? Hindi ka dapat para bang nalulungkot or nagagalit and all those things. All emotions are valid. Now, same as na pag nasugatan ka, hindi mo naman pwedeng utusan ng sugat mo na huwag magdugo at huwag magsakit. Huwag sumakit. Magsakit, no? Huwag sumakit. Alright? So, if the person is feeling angry, kahit tingin mo naman na parang wala naman siyang dapat ikagalit doon, just let them. When it comes to emotions, okay, and in our own emotions, okay, so remember this, my dears, no? You just need to understand it, sit with it, but you don't need to do anything about it or to act on it. Because emotions are warning signs, okay, that there's something wrong, okay, somebody has crosses your boundaries, or because you're just human and you feel. Okay, but emotions is not necessarily, let's say, a good basis for us to make some decisions. Okay? And then encourage them to talk with a mental health care provider or a primary care provider if that would be more comfortable with them. So wag po nating pinipilit ang healing, ha? Kasi kanya-kanya po tayo. Now, kung halimbawa yung friend mo lapit ng lapit sa'yo, and you think na parang hindi mo siya kayang tulungan, it's all right na friend, I don't think, no, that I'll be a good help to you. Kasi ito lang yung kaya kong ibigay. This is based on my understanding. And for us psychotherapists or psychologists, no, kapag hindi ko kaya yung client, I escalate it to my mentor or I refer them dun sa iba kong colleagues, no, that can better help them. Hindi yun kakulangan sa inyo, okay? Or hindi yun para bang kabawasan sa inyo. It's just that you care more about the well-being of the person. At hindi rin natin sila tinataboy, okay? Hindi rin natin parang gano'n. It's just that it's me, no? Hindi sapat yung experience or knowledge ko at hindi po natin dapat sila pinipilit. Now, for some people, it may be helpful to compare the situation to a physical concerns and how would they respond. Okay? So, for example, if they're already suffering from their mental health, no, ano ba yung usual na gagawin mo? Di ba or let's say physical health rather, suffering from a physical health, ano ba yung usual gagawin mo? Di ba magpapa-check up ka sa doktor? Okay? Magpapa-consult ka. So, same goes with the mental health. It's the same approach. Body and mind is interconnected. So if there's something wrong with your body, or if you want, let's say, a good physical health, you exercise, no, and you feed it, no, with good food, with nutritious food. So same goes with your mental health. Yung exercise niya is being mindful, no, being, let's say, conscious of what you're doing. Try not to hurt people around you. Try to reflect, and that's the exercise of the mind. Okay, and at the same time, you feed it with good thoughts, no, with inspiring words. Okay, so for you to have a good mental health. So same goes with the physical health. And remind them that seeking help is a sign of strength. I actually read this quote from, I've read this in LinkedIn with, I'm not sure where did Francis Kong get it. Para bang you have to be strong enough, okay, to stand on your own. But you have to be wise enough to know that there's something wrong, okay? And you have to be brave enough for you to seek help. Wala pong masamang humingi ng tulong. But of course, when it comes to therapy, no? Just also gonna share this. It's not just only us therapists nakasalalay yung ikagagaling ng client. We are just guide. This is what helps. This is the approaches that help dun sa condition mo. But of course, yung tao or yung client should also have this determination to heal. And actually, that is the number one, no? Para bang sabihin natin na benchmark or indicator kung gagaling ang client o hindi. No? It's their determination to heal. Okay? Sorry. So, remember, you cannot recover from anxiety by just staying calm. You cannot recover from depression just by being positive. And you cannot recover from anorexia nervosa just by eating more. If mental illness were that simple, we wouldn't be struggling in the first place. Kung simple lang ang mental health, okay, or mental illness, wala na sigurong course ng psychology, di ba? Okay, that's why we are needed more than ever. And of course, I'm just gonna leave my last message. Be a blessing and a hope. Your light can be someone's guide who is trying to survive. Maraming salamat po.